My name is Dr. Anne Laure Humbert. I'm the director of the Center for Diversity Policy Research and Practice at Oxford Brookes University. Today, I will be talking about some of the work that we have been doing in collaboration with the Royal College of Nursing on gender pay in the nursing profession. The report that we've done is first and foremost a reflection on nursing as a profession, but also how that has been shaped by gender. First, some background. Research previously carried out by the Royal College of Nursing has shown that its members feel undervalued and that pay does not match the level of responsibility, the levels of autonomy and accountability in nursing, the levels of stress and pressure, the demands made of nurses, the skills, education and training required in the profession, and the increasing scope of practice. In terms of context, there is also alarm in terms of staffing shortages and perceived failures in care. Nursing has been described as a profession in crisis, yet it seems that little is changing. This raises a number of questions. First, would any other profession be treated like this? And is it related to the gendered composition and construction of nursing? The crisis is visible through recruitment and retention issues. There are over 40,000 vacancies in the NHS in England alone, and that's equivalent to about 1 in 9 jobs. According to mainstream economic theory, we would expect that supply and demand should influence wages. So why is that so different in the context of nursing? In our work, we go back to 3 defining characteristics of what a profession is to better understand what is going on in nursing. In terms of professions, we start first by talking about occupational closure and boundaries. In nursing, there is a clear occupational boundary thanks to registration, which was introduced in 1919. Yet this is very often in tension with other boundaries, notably with medicine, but also other occupational groups, such as healthcare assistants and staff in support roles. When it comes to professionalization, the second characteristic is knowledge claims, or what counts as nursing knowledge. Nursing benefits from a very developed body of work when it comes to practice and research, but there are very blurred boundaries between other areas, such as, for example, psychology or sociology, and of course, medicine. Professionalization also relies on the third characteristic, which is that of autonomy and control over work processes and practices. And of course, in nursing, control is often imposed from the outside, with highly structured patterns of working through the service needs that are largely left unquestioned. There has been a clear move towards professionalization in nursing, but that has been less successful than in other professions, such as, for example, pharmacists. What's certain is that professionalization provides part of the explanation for low pay. Yet the role of gender needs to not be neglected, particularly in the context of wider socioeconomic patterns in the way pay and wages are set. There are different ways to understand wages. For example, wages can represent a standard of living, and that's historically wages being influenced by the male breadwinner model. As society moves away from this model, this nonetheless continues to devalue women's work, or so-called women's work, and that is unfortunately embedded in job evaluation frameworks such as Agenda for Change. Second, wages can be understood as a social practice and are shaped, for example, by factors such as gender, class, or ethnicity. In nursing, this can be seen by the under-evaluation of caring and emotional skills, which are seen as natural feminine traits. Third, wage setting can be regarded as a management tool To understand this, we can consider that sometimes there is an opposition between job satisfaction, for example, through flexible working conditions or vocation, having a sense of having gratifying work, and accepting this as a trade-off for lower rewards and pay. Fourth and finally, wages are influenced by the macroeconomic context, and the role of social actors here is key. So, for example, through trade unions, employers, or governments. In the UK, austerity since the financial crisis of 2008 has led to a reduction in the pay bill for the public sector. Unions have been attempting to fight back against these cuts for a number of years and to fight for working conditions and pay, notably in the nursing profession. When we look specifically at data in the health sector and in nursing, we see that women in the entire health sector earn on average 30% less across all health professions. Specifically in nursing, and here we know that 90% of nurses in the UK are women, pay for registered nurses is 81% of the healthcare average. There's little variation in pay among registered nurses. And what this suggests is that more skills and experience does not actually translate into higher rewards and pay. In 2018, gross weekly pay for men in nursing was on average £617, compared to £512 for women. And this represents a 17% pay gap. Our research shows that this is largely driven by working hours, as pay on an hourly basis is approximately £15 for both women and men in nursing on average for the same time period. Our work suggests that there is a need for several recommendations, of which I will outline 2 today. It is clear that there is a need for an in-depth assessment of knowledge and skills in nursing on its own terms, but also in relation to other professions in the healthcare sector. And this means looking at job descriptions and evaluation frameworks, paving the way for fairer and more realistic job evaluation frameworks. The second is an assessment of how the work is organized and to consider more modular approaches and how that might be more beneficial to cater for the needs of nurses at different stages of their life course. The work that we have done at the Centre for Diversity, Policy Research and Practice in collaboration with the Royal College of Nursing is available on our website. Please get in touch with us through social media channels.